Good morning. Welcome and thank you for joining us for our Northern Light Health Business to Business Zoom conference. Today, our theme is unique opportunities created by COVID-19. People are being vaccinated as quickly as doses are sent into Maine. We're hearing more about variants and what that could mean. Hospitalizations are creeping back up, including more people in the ICUs, and the daily case count of people testing positive is still too high. Through it all, we are all learning. We'll be talking about recruiting and retaining employees, supporting a remote workforce, growing through trauma, and the latest on COVID-19 and vaccinations. I'm Dr. Ed Gilkey, Senior Physician Executive at Northern Light Beacon Health. I'll be your moderator for the next hour. Our panelists today are Lindsay Hamilton, Director of Provider Recruitment and Retention at Northern Light Health. Paul Boland, Chief Human Resources Officer at Northern Light Health. Angela Felicia, Director of Healthy Life Resources Program at Northern Light Acadia Hospital. Dr. Jim Jarvis, Director of Clinical Education and Incident Command Section Chief at Northern Light Health. Before we get started, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply in your specific situation and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and/or your customers and clients will not contract or spread the coronavirus. A reminder, this hour is for you. If at any time you have a question for one of our panelists, please use the chat function. I'll keep track of your questions and have our speakers respond. Also, I hope each of you will take a few minutes immediately following this hour to answer our quick 5-question survey. Your input directly affects our topics and helps guide our future conferences. Our panelists will share some key information first, then we will have questions and answers. First up is Lindsay Hamilton, who will share recruitment insights from this past year. Lindsay?
Thank you so much, Dr. Gilkey. Recruitment and retention is such an exciting topic to discuss, since it's one of those areas that applies to all industries and really doesn't matter if you employ 10 or 10,000 employees. At one time or another, you'll be faced with the challenge of recruitment, and then once you do successfully recruit, the challenge of retaining your new employee. Today, I really want to focus on keys to successful recruitment. But I do want to start off by saying that although I currently work in the realm of physician recruitment, the keys that I'm going to be sharing today are applicable and can apply globally to any type of recruitment effort. My colleagues in talent utilize the same keys in their recruitment efforts as well. The first key to success is making sure that you're developing a robust marketing plan. So you may ask yourself, what is a marketing plan? And essentially, a marketing plan is talking about what you're saying in your advertising. This involves identifying a list of selling points or highlights about your position and knowing what differentiates you from others in the same industry or in the same community. Essentially, these are the aspects that ultimately draw your candidates to apply for your position. Examples of selling points can include a hybrid work schedule or remote work schedule. They can include a 4-day work week, a robust compensation package, bonus eligibility, growth opportunity. There's a myriad of things that you could highlight as part of your position. If you find that you're having a hard time identifying these selling points, the easiest thing you can do is talk to your current employees and find out what engages them, what keeps them coming back to work every day, and ultimately what caused them to apply for the position they're in now. Typically, your own employees can guide your marketing plan. I also want to suggest that if you find that you don't know what these selling points are or highlights, you want to pause your recruitment and develop those highlights before you start advertising for your position. Because if you don't know what those selling points are, you're going to be less apt to attract top talent. Once you actually have candidates in the pipeline, you want to make sure that you're conducting thorough interviews. This doesn't mean making sure you have identified a list of 24 of your favorite interview questions. This means that you're creating an interviewing dynamic where you're asking open-ended questions, which are questions that don't involve a reply of a yes or no. You want to make sure that your interview is a two-way conversation between you and the candidate. It's not only important that your candidate understands the requirements of the position, but you should leave the interviewing knowing what the candidate is looking for in their next opportunity. What are their expectations? What do they want in a position? Too often we find ourselves concentrating on what our business needs in our next employee, where we don't spend time getting to know what our future candidates might need from us and what they're looking for. You also want to make sure that candidates learned enough about the opening to make a good decision, and that you may learn enough about candidates in order to make a good hiring decision. You don't want to hire too quickly. You want to make sure that you're making the right decision, because this is a long-term decision for not only your company, but your employees. Typically, at the end of every interview, I always ask candidates if they can explain what their understanding of the position is. And I use this answer to gauge whether they truly understand the expectations and requirements of the position. Lastly, it's critically important to leave ample time for questions so the candidates can have a chance to ask you questions. This is where you actually learn what's most important to your candidates. In talking about communication, you want to keep in mind that there's no such thing in the interview process as too much communication. You always want to maintain ongoing communication with your candidates to keep them informed of their application process. Your stellar candidates are most likely applying not only to your openings, but in other openings. And you don't want to have the fateful reaction that if they don't hear something from you, they've made the assumption that they're no longer a contender. And in reality, you're just working through administrative processes in the background. The last thing is you always want to keep in mind how it ends matters too. It's almost more important than actually how the interview goes, especially how your organization is seen in the community. Even if you don't ultimately choose a candidate, that candidate could be a perfect fit for another opening you have in your organization or a future opening that you don't even know about. You want to make sure that you're creating a respectful recruitment experience for that candidate. It's critically important to treat all candidates with respect during the duration of the interview process. Applicants will end up sharing their experiences with their friends, their colleagues, their coworkers, their acquaintances, and ultimately people will make decisions whether they want to continue being a client or a customer based on the feedback that they receive. Word of mouth is incredibly powerful, and it has far-reaching impacts, not only to your recruitment efforts, but to your client base. And always remember that retention starts with recruitment. So keep in mind that all recruitment strategies are retention strategies. I'd like to shift gears and talk about changing priorities in recruitment. It seems appropriate during these times. This basically describes my last year in recruitment. You would never want to be afraid to change your recruitment priorities or strategies or selling points. In January of 2020, I distinctly remember a group meeting my team had in person, which seems incredibly apropos right now, where we talked and developed a list of what we were going to use in our marketing strategies for 2020. This list included talking about our service lines, which were growing, our robust technology, our robots. We had a whole host of things. The priorities of our applicants shifted with the pandemic when it hit. Candidates, instead of looking for positions out of residency, were now more interested in keeping themselves and their families safe. Candidates were facing hiring freezes, layoffs, uncertainties of their family and their friends, their own safety. Because of this, we had to jump into action and completely rethink our marketing approach. We developed new highlights. We then started highlighting our rural opportunities, our family-friendly locations, our low COVID vulnerability rate, which we were one of the lowest COVID vulnerability rates in the nation. We wanted to make sure that our marketing initiatives and advertisements showcased Northern Light Health employee-centric response to the pandemic, as we soon found that this was not only unique to Maine, but unique to the nation. We went from a high-touch recruitment process that involved in-person interviews to virtual interviews, including virtual tours and meet and greets with community members and our own medical staff from a virtual standpoint. Next slide. As you can see from this bar graph, the teal color in the bar represents our in-person interviews. So as you can see, in the first 5 months of our fiscal year, all of our interviews were done in person. In March 2020, virtual interviews were implemented due to COVID risk mitigation. Virtual interviews are represented in the yellow or gold color that you see. By quickly pivoting to virtual interviews, Northern Light Health was able to pivot to travel restrictions while still recruiting providers for today and into the future. We quickly found that this strategy proved successful in not only candidate experience, but our own recruiting efficiency, and had significant financial savings to ourselves and candidates. Surprisingly, as you can see, we actually conducted more interviews following the start of the pandemic than we did before the pandemic had hit us. Going forward, we found that virtual interviews are here to stay and how incredibly beneficial they are. We are now more intentional in who is invited for in-person interviews, which has decreased interview fatigue of our staff, cost, and the delay in the selection of candidates. Next slide. Ultimately, virtual interviews, virtual innovations, our interviewing process, amazing teamwork, and grit, as Tim Dentry refers to it, paved the way for our success in our recruitment efforts. When we look at the numbers, we saw a 47% increase in provider interviews. We saw a 22% increase in offer letters and acceptances. We saw a 25% increase in providers who started work in 2020. We saw a 75% increase in acceptances. And still, a fact that's staggering to me is over 100 providers signed on virtual visits alone. I thought I'd pause here and tell a story that I've told in a couple of different venues because it still shocks me that I can tell this story to this day. There was a provider that I met years ago at a conference. He was well respected in his area. I've been trying to recruit him for years. I always had ongoing communication with him, but he was never interested in practicing in Maine. I never gave up, and we developed a bond. We reached out to him just like we did many other people when the pandemic started, and we shared what our marketing response was, what our Northern Light Health response, I should say, was to pandemic. He was finally in a place to explore opportunity as his priorities has shifted. He was now looking for a place for his children where his children could just be kids and go and play on a playground. So he was open to a virtual interview. We ended up conducting 2 virtual interviews. With our practice teams, we included leadership, we include his future colleagues, but we also were able to do a virtual community tour, a virtual tour of the school, which was no small feat considering the schools had been shut down at that point. During this time, both him and his spouse were able to meet key community members, part of community organizations that both him and his spouse were passionate about, and he ultimately signed on with Northern Light Health and started this past summer. I actually ran into him about a month or so back, and I asked him how he was acclimating to Maine, considering he had officially survived his first Maine winter. And his comment was staggering. He said that he wished he had made this decision 10 years ago, which was impressive. And, you know, we laugh about it to this day. When you look at this map of the United States, you can see visually that our marketing plan has had incredible reach. Even though most of my team last year was working in their makeshift offices from home, we were able to successfully recruit from 42 out of the 50 states. Next slide. One more. With this success in recruitment, we've been able to fully staff many of our specialty care practices and primary care locations. This is incredibly exciting to the communities of Maine. At the end of this presentation, you will receive copies of these slides, and I invite you to explore all of our locations in these interactive slides. Many of our practice locations are accepting new patients throughout the state of Maine. Thank you.
Thanks, Lindsay. Next is Paul Boland, who will provide policy and training insights to support a remote workforce. Paul?
Thanks, Dr. Gilkey. And so I just have 3 slides for this topic because I'm hoping that there's some good discussion in the question and answer session, because I think this is an interactive discussion that's really, there are some general guidelines I think that are good processes to go through, but each business is a little bit different. So I'm happy to engage in some good lively discussion on that. But what we found throughout COVID is really an acceleration really of the remote work that we had done in small groups prior to COVID. So we've got groups such as coding, medical coding that are in billing practices that are working largely remote, and those staff are have been doing that for several years. But of course, COVID accelerated things out of necessity. Several advanced fast forwarding in a couple of months, what would have probably evolved over 3 or 4 or even 5 years. But what we learned is for a lot of roles, not everyone, but for a lot of roles, we saw increases in productivity, especially early on, as people were excited about the changes. And so, initial concerns of people working during the early days of COVID who didn't have a need from a patient care point of view to be on site. We're certainly delighted to be able to work from home, and we were able to accommodate that with our IS infrastructure to ensure they had a secure connection. And so we've seen a lot of increased job satisfaction. But Lindsay talks about our recruitment team, and I think about our non-provider recruitment team, which is recruiting every other position that we have, about 1,200 posted jobs right now for Northern Light. Our recruiting team told us overwhelmingly they can't wait to get back in the office. So this applies, to some groups, groups that are generally extroverted are going to want some connection with their coworkers and colleagues. And so a couple of things I want to talk about through this focus on you can accomplish both with remote work, and just keeping an eye on the fact that being continuously remote for an extended period has certainly some positives, but also things to consider. And in the next few slides I'll go over why a balanced approach to be attractive and an attractive recruitment and retention tool. What we did and we found helpful was to create, first of all, an initial guideline. We had an initial policy in place. We added to that and made amendments due to COVID to make very explicit what the requirements of everybody would be in terms of what can employees expect from their department and their leader, what we can expect from the employee. So there wasn't any gray area in terms of hours of work and how the work would be expected to be measured or performed, and also challenges of onboarding and orienting people who aren't stepping foot on our property. I think about some of the discussion that Lindsay just had before me, and we hired some senior leaders who from out of state. One in particular whose office is across the hall from me. She and her husband bought a house here sight unseen, just through a virtual tour, accepted the job here through a virtual tour. And it wasn't until she showed up for her first day of work that she actually set foot on our property for the first time. So these are really unusual times through COVID, but we've learned a lot of positive things can come of that. And I mentioned before, engaging remote workers, making people feel connected to their colleagues, and there can be virtual work meetings, but there also is opportunity to have in-person interaction. And as we emerge from COVID and some of the social distancing is appropriately relaxed as we develop herd immunity and large numbers of vaccinated populations, that will increase in terms of the ability for people to have periodic meetings in person or work events or retreats, whatever is appropriate to your work environment. But that all contributes to a better remote work experience. Next slide, please. The focus, of course, typically has to be, what does the business need? What does the employee want out of this? And have a discussion. But first and foremost, the operational needs need to be met. So whether it's a patient, a customer, or an internal process that needs to be maintained, that needs to be understood first. And how do you measure productivity? It's different for every job. Is it at the end of a certain time period, there's a work report or an overall work product, or is it something ongoing, such as invoicing or something else that can be easily tracked? Other considerations include data security concerns, as I mentioned before, but also what about ergonomics? What about workstations? What about equipment that may be needed to perform the work. How is that assigned to people? How are they provided not only the equipment, but if they leave the organization, how is that retrieved? And ergonomics and safety. Maine in particular has our VDT law. So every year we need to provide training regarding our ergonomics in the workplace. And that includes the workplace at home, if that's where people are assigned. So although you might not have a typical ergonomic evaluation on site in someone's living room, if that's where they're working and they become injured there through repetitive motion, then that's just as much a workplace injury as if it happened in an office. So all things, those are all important considerations to have. On this next slide, please, there. So ultimately what we learned as we developed and evolved is communicate transparently with employees along the way. We didn't understand or know everything along, and we were clear about that. We're learning as the rest of the country is, as employees themselves are and their families. And we were quick to pivot with things such as our paid time off and other policies to be more appropriate for the environment of COVID, and also more appropriate for remote work. In some situations, that means that some positions, hourly or salary positions, the hours could be more flexible if you're working at home. Some roles, we need someone to answer calls and emails in a certain time period. Others, it matters less as long as the work is done and employees are accurately tracking the time that they're working. So the flexibility varies based upon the role. But having leadership rounding and presence, we found, was very important. Interaction, whether virtual or otherwise, with senior leaders as well as immediate supervisors, really was a very important component. And ultimately, encouraging growth through different ideas and innovative ways to make this a better experience. One of the things that I think is important to note, that we have some employees who are remote are also out of state. And one of the significant considerations with that, Lindsay mentioned recruiting from multiple states. We've got folks who are working remotely full-time from other states. And I'm sure many of you do as well. And what that means, though, is that you need to be aware of and compliant with the various laws and regulations of those states. I mentioned the VDT training for Maine. That is certainly something Maine has, but other states have different requirements. So it's important to make sure that you're up to date on what those requirements are. Just a new additional consideration in the world of remote work environments.
Well, thanks Paul. Thank you. Next is Angela Felicia, who will talk about the community growth we've experienced due to this shared trauma. Angela?
Hello, thank you. And I'm happy to be back here talking to this webinar group. So one of the things I've talked about and covered over the course of the year is certainly the stress related to this unprecedented, right? That's the word that we hear all the time, how unprecedented the pandemic has been, this once in a lifetime event. Obviously, it has been extremely stressful. In fact, that's something that we could call a collective trauma. So there's several definitions of that. One that I like, because I think it just captures all of the various challenges that we've encountered, is the stressor, or the definition that says that collective trauma is a cataclysmic event that shatters the basic fabric of our society. Certainly the pandemic has done that, not only in the workforce, in our family life, in our school life, even going to the grocery store has turned into something new and different. So again, all aspects of life, we are impacted by this event in a way that we probably have never, and hopefully, knock on wood, will never experience again. Usually if there is a large event, it happens in pockets of our society. I'm not from Maine. I like to, people tell me that I'm still from away. I've been here almost 2 decades, but that still doesn't make me from Maine. I do remember, however, the big ice storm, right? That was an impact on our state, but not necessarily on the country or the world like the pandemic has been. Next slide. Certainly, crisis is by its nature challenging, but crisis also provides us new opportunities, new growth challenges, and ways that we can think a little bit differently about business as usual. My two colleagues there, Paul and Lindsay, really highlighted the ways in which we across our Northern Light Health system had to think differently about this crisis, how we needed to build that resilience, that grit. You know, we are certainly not alone. You and many of your businesses probably have also managed to change, grow, figure out a new business model. But great thinkers and leaders across all generations have certainly recognized that trauma, crisis, while it is stressful, also can be that impetus for building new ideas and creating new opportunities. Next slide. One of the things that I think is really important and wanted to share with you all today is how, yes, the pandemic has been stressful, filled with crises on many fronts. There's also this phenomenon of some post-traumatic growth that has occurred in the context of this pandemic, in this collective traumatic event. You know, we as a society have all figured out how to sort of come together in ways that perhaps we would have, but it maybe would have taken a lot longer, or perhaps in ways that we never would have thought to do before. You know, I've been involved in this webinar for the past year with colleagues that are at a different member organization. I may have not have had an opportunity to get to know them and interact with them. That's probably true in your workplace as well. You've gotten to know colleagues, co-workers, perhaps even other industries as you've looked to sort of grow and morph to meet the needs that have come about in the context of this pandemic. You know, we've also seen really fantastic examples of altruism or just general helping. You know, we've been hosting these mass vaccination clinics. Those are an amazing example of this truly altruistic spirit of the entire community, because it's taken the entire community to really put those types of events together. Next slide. And then, of course, this post-traumatic growth in regards to resilience. So our individual resilience, perhaps you felt that more on some days than others, but we as a culture, as a workplace, as a society writ large, have really experienced how do we do this thing called resilience? How do we develop our grit? Families have had to figure out, how do we continue to have the kiddos get their education while still maintaining employment and trying to get dinner on the table? Lots of examples of this resilience, this ability to really change quickly and come out on the other end of that has been particularly extraordinary for individuals, but then of course also for consumers, businesses, etc. And next slide, Lainey, thanks. And then of course, innovation. We can't speak enough about how this collective trauma of a pandemic has really impacted and accelerated innovation across the world. The virtual technology, you know, we've been meeting via Zoom. I'm always the first one to admit, my friends and family used to joke with me that I was quite the Luddite. I was a little bit terrified about doing all this sort of virtual Zoom. Now it feels second nature to me. These platforms and the tech industry has certainly stepped up to make all this virtual environment so much easier and more user-friendly for us. New business models, I'm sure some of you have experienced this as well. These new business models have cropped up and many of them are probably here to stay. So we've seen great growth in ways that we couldn't have imagined before. That really actually ties to that resilience too, right? So we've had to really innovate think differently so that we can continue our business. And then previously, I think people would talk about sort of work-life balance. And in this new world, it's really about work-life integration. With so many employees working remotely, certainly not all, but such a large amount of employees working remotely, we have had to figure out how to integrate work into life so that it's no longer someplace you go from 8 to 5 and then you come home. And so that separation has ended a bit, and that work has started to integrate into people's lives, which has created lots of new opportunities for both home and work life. And then, of course, science and medicine, right? Never before have our scientific community been able to put out vaccines in such a short amount of time. It's truly extraordinary that we've been able to do that. That level of innovation, collaborative work as well, where you've got what used to be sort of competing pharmaceutical companies actually sort of working together in conjunction with each other, with the government, to produce these needed results is really quite something. One thing that I've been so reminded of constantly, right, is pre-pandemic, myself, others, probably many of you on this webinar, would really strive for perfection. And often that would mean that a change, a new opportunity might take months or years to implement. Right now, perfect doesn't have to be the enemy of good. We can just go ahead and try it. How's it going to work? And then just make those modifications. It even goes back to that collaboration. I would say society as a whole has been much more forgiving of trying new things, having them maybe not succeed fully, and then coming back to try it again. Really highlights that post-traumatic growth, where we're sort of okay with putting ourselves out there in a way that perhaps we wouldn't have done so before. And then next slide. And I think it's really, really important to think about all the various ways across society that we have grown from this pandemic. Certainly, I talked about the science advances, tech advances, but we've really been able to demonstrate real empathy with each other. I myself have been working remotely over a year now, and I've gotten to know my coworkers in ways that I wouldn't have gotten to know them before. You know, sort of seeing dogs, seeing cats sort of walk across laptops, kiddos in the background, asking mom or dad to open a snack pack, really develops that real person interaction with your coworkers that I definitely wouldn't have had an opportunity to have before. This linkage as well, and this is actually something that Lindsay mentioned too, between your purpose, your culture, and your brand. You know, how companies, organizations have responded to the pandemic is really emblemental of their brand, the culture you want to create. And we've seen some pretty significant growth in that area as well. And I'll be happy to take questions later on in the hour.
Well, thank you, Angela. Next up is Dr. Jarvis, who will provide us with an update on COVID-19 and the mass vaccination program. Jim?
Thanks, Ed. I'm going to start off with some great news. As of April 7th, yesterday, all Maine residents age 16 and older are now eligible to receive vaccination in the state of Maine. Please remember that the Pfizer vaccine is authorized for individuals 16 and 17, and so that is the only vaccine that those under the age of 18 can get presently, which means that they have to go to one of those select sites that are able to handle the Pfizer vaccine. I'll remind people that in the state of Maine, vaccination does require consent from a parent or legal guardian. And for this particular vaccine, that consent is a separate one from the normal consent to treat that many have online with their primary care provider or health system. And so that is required. I'm happy to say that Northern Light Health allows that to be done either verbally over the phone or by using our online scheduling program and downloading a copy of the consent and having it signed. And therefore, those 16 and 17-year-olds who can drive, they do not need to have their parent present when they receive the vaccination. Great news is that over 420,000 people in the Maine have already received their first dose of the vaccine, making that about 32% of our population. Nearly 20% of the population is now fully vaccinated. Maine actually, I think it might have moved up to third since we did this slide in percentage of its population with at least one dose of vaccine. It wasn't too long ago we were actually falling in the numbers. We went down to 10th at some point, but have really had a dramatic increase in the number of vaccines that we've been able to distribute in the last few weeks. And not only have we vaccinated more of our population, but we continue to use a great deal of our vaccine as it comes into the state within a week of it arriving, which is also very good news. So next slide, please. But I did want to talk to you guys about today was about vaccine hesitancy. As employers, many of you will confront this issue in the workplace. And it's up to you to decide what your own policies are going to be, staying within federal and state guidance and state law as to what you can and cannot do. But the questions do come up about what do we do for people who are hesitant to be vaccinated. And there's a couple of categories of people who are hesitant. There are those who, for many reasons, just flat out refuse to be vaccinated. And no matter what the discussion is, you're probably not going to change their minds. But there are those individuals who are hesitant for reasons that are amenable to education. And so really what you really want to do is look at those people who we can move to the middle. So have that conversation. But really the conversation needs to be on their side. You really want to listen to what their concerns are. Why is it that right now they are not considering or are hesitant about getting the vaccine? For some, it's simply just needing a little bit more education. And so that education can easily be provided. I remind people to reach out to respected and informed sources. For many people, that will be their primary care provider. But for many people, it's going to be leaders that they see in their community. And you can be that leader as well. So providing simple explanations about the vaccines are important. When we talk to most people who are hesitant about the vaccine, it usually comes down to either safety or side effects. And so safety is an easy one for us to talk about. With most vaccines that come on the market, they've only been tested in a few thousand people before they get to the market. And it usually takes quite a while before we even reach 1 million people who have actually been vaccinated with a new vaccine. But that's not the case with these vaccines. First and foremost, the Pfizer and the Moderna vaccine, which do use a relatively new technology. It's a technology that has been around for a decade, and we've been using it in other areas, including other vaccines before we used it in this particular one. But what's also noted is that there were tens of thousands of people in the initial trials. But since we've been giving out this vaccine, there are now 100 million people who have received both the Pfizer and the Moderna vaccine. That is a tremendous amount of individuals. For most other things, when we talk in healthcare, a new medication that comes on the market, a new tool that we use in the operating room, or any other new thing, usually we talk about thousands of people have been in those studies. Now we're talking about 100 million people. And the great news is that we have seen no severe effects from any of the 3 vaccines that are currently approved or currently have emergency use authorization in the United States. That's a tremendous amount of data and makes people like me who do this for a living feel very, very comfortable to say these are extremely safe vaccines. So what about side effects? The overwhelming majority of people who have been vaccinated will state that the worst thing that they had was a sore arm the next day. Certainly, some people have come down with as much as flu-like symptoms, typically lasting no more than 24 hours. So one thing that you can do as employers is be understanding of your employees. When they say, hey, I'm going to get vaccinated tomorrow, realize that possibly the day after, they may not be able to come to work because of the side effect of the vaccine, and just simply be understanding of that. They're taking care of themselves, but not only that, they're protecting the rest of you. Don't shame people. What you don't want to do is have that confrontation with somebody, particularly within the workplace, with somebody who is completely against the vaccine and may be providing information that is flat out wrong or not factual. That's the time to simply agree to disagree and then move on. And then share your own experiences. One of the things that I have done time and time again is when people ask me, why did I get the vaccine so early in the vaccine rollout when I knew that things needed to be tested? Well, one, I knew they had been tested. I knew they had been safe, but also it was the people that I needed to protect. So for myself as a physician, I needed to protect every single patient that I come in contact with in my job, And that's important. It's unconscionable for a healthcare worker to infect somebody else with a disease that's preventable. But not only that, I have a daughter at home who's a cancer survivor. So I needed to protect her too, because we don't know what her immune system is like. It's quite possible that she could get infected with the virus and have more severe symptoms than would be expected for someone her age. So think about who it is that's in your life that moved you to get vaccinated. And sharing those stories, if you're willing to do so, has been the biggest thing to help convince others. I had a great experience just the other day where we had a multi-generational family coming in for vaccination. We had great grandma, grandpa, and grandson all there. And great grandma and grandpa both were getting their vaccines. And then they said, yeah, we're still working on him. And I turned to him and I said, you're not getting vaccinated for yourself. You're getting vaccinated for these two individuals who are sitting next to you, who you obviously care so much about. And he said, I think you're right. I'm going to really reconsider my thoughts, and maybe I should get vaccinated. And be patient. Offer to help people. Offer to give them guidance. Send them to the right person to give them straightforward, factual information, and to just be there as a companion to be able to help them in whatever circumstance there are. So next slide, please. And here's the reason why we need to be vaccinated. Because unfortunately, despite the fact that we are doing well now in the vaccination process across the United States, at the same time, we are also seeing case counts of COVID-19 increase again. Here in the state of Maine yesterday, we had over 400 new cases of COVID-19. If this was October, we would be extremely alarmed by a number that high. Unfortunately, we've kind of gotten to this false sense of security because of how high our numbers were back in the early part of this year and the end of last year. But 400 new cases is actually where we all started to panic before. And so we need to be aware of that. The other cause for concern is that these cases are actually in a younger age population than we had seen before. We used to talk a lot about people in nursing homes and other elderly patients being the ones who are actually being the most infected with COVID-19. But actually, we're not seeing that now. Some of that's due to the success of the vaccine and that the vaccine in people over the age of 70 has had a high uptake. We're also seeing that those variants that are out there, and now the variant from the United Kingdom, which I've spoken about in the past as being more infectious, is now the dominant strain in the United States. And unfortunately, in Maine, we're seeing that particular strain now become the dominant strain here, which means once somebody is infected, they can infect more people with it more rapidly. And so that's where our cause for concern are. The other cause for concern, and is one that you can talk about with people with some vaccine hesitancy, is that younger people seem to be being affected more by this particular variant and across the country. While we haven't seen a huge increase in the number of hospitalizations, though hospitalizations are still pretty high, what we've seen is that these individuals are having issues. And a recent study just came out last week that said up to 1/3 of all individuals who've been infected with COVID-19 have had cognitive deficits at least 3 months after their infection. That mostly is in people who've had severe disease, but it's also in people who had mild disease, like many of our young people. As a parent of 2 students who are in college right now, I don't want them to have any cognitive deficits while they're right now in their formative years of getting their education. So protecting them and having them protect themselves against COVID-19 is important. We're seeing some other long-term complications from COVID in young people who had very mild disease, but months later are still having issues with fatigue, concentration, and some with more serious illnesses that they didn't develop initially. So that's our cause for concern. Our hope is there. That's why vaccination is here. So I hope that you support your employees, customers, staff, and everyone else that you come in contact with and encourage them to be vaccinated. And with that, I'll turn it over for Ed. I think we're getting ready for questions.
Well, thanks, Jim. Now let's focus on those questions. I will group similar questions together so we can address as many questions as possible. Jim, actually, the first question is for you. A pretty straightforward question. Is a 4th wave coming? And here we go, using your very foggy crystal ball again.
Yeah, so again, in my opinion, Maine never really had a 3rd wave, which was good news for us. We've been a fantastic state in keeping the virus under control, but that's still, we still have over 700 Mainers who lost their lives, meaning 700 families are mourning the loss of a loved one that could have been prevented had we all taken the precautions necessary, or now preventing future deaths by getting vaccinated. But around the country, we are seeing another spike. And with this particular variant, the one that was initially identified in the United Kingdom, it does set us up for a 4th wave around the country, probably a third wave for here in Maine. And there's a couple of factors for that. One, as I already stated, younger people seem to be getting more infected with this, and younger people travel more. We recently had winter break, and now in the midst of spring break, and soon all college students will be returning home, whether that's they're leaving Maine to go back to their state, or leaving their state to come back, leaving their state where their college is to come back to Maine. And that kind of travel is a definite setup for us to have a fourth wave. And so we need to be concerned. Again, vaccination, single best way that we can prevent that.
So thanks, Jim. Certainly recognizing that the dominant variant is as much as 70% more transmissible, and we have to really focus on the basics. So we're really talking a lot about vaccination, but not to forget those other key elements. If you wouldn't mind sounding like a broken record and sharing those with us.
Absolutely. Even when I vaccinate people for their second time and tell them in 14 days that they can consider themselves fully vaccinated, we remind them, please wear your mask when out in public. Please don't gather in large numbers. Wash your hands frequently. And when you're near other individuals, keep 6 feet apart.
So those basics really make a big difference.
Yep, and we know they've made a big difference, because if you look at our influenza rate in the state of Maine, typically by this time of the year, we've lost 150 to 200 Mainers to influenza. We've only had a few deaths due to influenza so far, and in fact, our total number of cases of influenza in the state is less than our typical year of deaths from influenza. Masking and physical distancing actually work to prevent respiratory virus spread.
Hey, maybe we can coin a new term, collateral benefit.
Very good.
Thank you. Lindsay, the recruitment playing field seems to have changed this past year. What are you finding that appeals to applicants these days?
That's a great question, Dr. Gilkey. We're finding more than ever positions that allow for a work-life balance, are friendly and hours, flexible schedules, remote work are what people are looking for. Gone is the day to employees that they want to come in and work from 7 a.m. to 6 p.m. at night. Employees want to make sure that they have ample time for their friends, their life outside of work. Based on the pandemic and what we've seen an uptick with the amount of people that actually want to do that from home. Not surprising based on Paul's presentation.
Yeah, thanks, Lindsay. Paul, should the training include self-care for remote workers?
Yeah, absolutely. I think as Angela outlined, self-care is an important thing. I think whether you're on site or whether you're remote, caring for yourself and having stress management techniques and other means of juggling the stressors and challenges of daily life are important regardless of where your work setting is.
Great. Thank you. Angela, how do you make some of the positive changes stick long term?
Yeah, that's a good question, right? One of the ways I would suggest we do that is we really reframe our thinking. So many times I hear folks talking about, when do we get to go back to quote normal? So I would instead encourage us to say, what about the changes that we've made do we actually want to keep? And how do we keep those in place? What do we need to do and shift and create new policies around, or new procedures to keep some of these positive benefits in place, so that we're not just thinking about reverting backwards, but instead, how are we going to move forward post-pandemic? What's that going to look like?
Yeah, thank you. Dr. Jarvis, is it safe for me to walk with another person if we both have had our second dose and wait 2 weeks?
Yes, actually it is. The new guidance from the Centers for Disease Control state that individuals who have been fully vaccinated, meaning that either they've received the first dose of Johnson & Johnson or the second dose of Pfizer or Moderna and waited 2 weeks, that those people can actually be together unmasked. And in fact, families can do the same thing as well. And so that's good news for people. It's why you've often heard grandparents saying, I can finally hug my grandkids again because I'm fully vaccinated and have waited my 2-week period before engaging in that activity. So that is good news. But again, when we're out in public, we don't know who has been vaccinated and who hasn't. And we also know that people who are fully vaccinated can still become infected with the virus, though most likely will do very well if they did become infected with the virus, as we had no cases of people with severe illness or death who have been vaccinated.
Great, thank you for that information. Lindsay, are there retention lessons your team has picked up this past year?
I think the biggest, I won't call a lesson, but it's been a reaffirmation, is to listen to your employees. This year, far beyond any other year, has stressed our employees in ways that we never knew we were going to have stress. And I think being able to have an employee-centric response to any sort of business decision, and being able to have, as Paul talked about, thoughtful rounding sessions, check-ins with employees, are the critical tools that you need to retain your employees. And remembering that, Paul alluded to this, one size doesn't fit all. So making sure that you can take individual approaches to retention. What's going to retain one employee might disenfranchise another employee. So that's why those conversations are so critically important.
Great, thank you. Paul, I have a couple questions for you. Are there ways to cross-pollinate projects among coworkers that will enhance their getting to a better level of knowledge and friendships?
Yeah, I think that's a great question that Ed asks. And I think that it really depends on the work environment and what people are doing. But to the extent you can enrich people's jobs, it's not different assignments. It's just the variety of people with whom they work. And I think that provides for that rich work environment that everyone needs, whether it's virtual or in person. And absolutely, to the extent you can have, I'm going to have you work with this team or that team and get to know other people, it adds to that social component of work that's so important for everyone.
Great, thank you, Paul. Paul, this question might be for you as well. This comes out of Senator King's Bangor office. We receive calls from constituents asking if health insurance covers the cost of the vaccines and any post-care they may need, especially if they have severe side effects. We are educating people that there is no cost to the vaccines. What else should we be telling people to alleviate their fears about potential costs? So maybe you could address that.
Sure, I'm happy to, and Dr. Jarvis talks about this regularly on our press briefings as well. We're not charging any individual for the vaccine. We are charging insurance companies a fee if there's insurance available, and if someone doesn't have insurance, then there's no charge for the vaccine. The focus really is let's get people vaccinated, and the dollars, to the extent they're available, we'll process those claims, but dollars shouldn't be a reason people don't get vaccinated. And so we want people to take care of themselves, take care of their family and loved ones and communities by getting vaccinated as soon as they're able.
Great, thanks. Jim, anything else to add on that one?
No, Paul did an excellent
Okay.
description there.
Good. Then I have a different question for you though, Dr. Jarvis. After I am fully immune, can I safely be with a 6-year-old grandchild who attends school in person? Should we both be masked?
Yeah, so it depends on your definition of safely. Obviously, the safest thing to do is to continue to be masked. But I think for a grandparent who is not at high risk, meaning they don't have any other major health concerns, I think it would probably be safe to do so now. Or safer anyway. The recommendations are that if you are going to be with individuals who are not fully vaccinated, that everybody needs to no one needs to be in a high risk category. If there's somebody in a high risk category, you should all mask. So again, it's really just what your own comfort and safety are. I think though, in the scenario you described, for most people, it would be safe to do so.
Thanks. Dr. Jarvis, also, could you make a comment on possibility of vaccination passports?
Yeah, so this is one that befuddles me, how this has become a conversation with a lot of people polarized. So as a person who had been in the military, I used to dutifully carry my yellow, what many of us call the yellow fever, but really it was the World Health Organization vaccination card, because many nations required proof of vaccination against yellow fever to enter into the country. And in fact, in the United States, there were several countries that if you were visiting, you had to show proof of vaccination against yellow fever to return to the United States. And so we carried those around with us. Mine sat in my car for years, probably not the safest place to keep it, but it's so that I always knew where it was. And so I don't see this as being any different than that, but I think it has become that simply because there's the controversy about whether or not you can require individuals to be vaccinated, whether that's for employment, healthcare, or whatever, or can you mandate that the only people who can enter your businesses or industries are vaccinated? And I think that's where the question comes in. Personally, I think it's a great idea for us to have every piece of our health information readily available so that if you were in need of care, you could show that information, which would include your vaccination status. So already there are some companies who are working on some digital platforms to be able so people can show relatively easily that they have been vaccinated, particularly for travel reasons. I am pretty confident that there will be some countries around the world that will not let you travel to them unless you are fully vaccinated and can show proof thereof. And that's where having something certified like a quote vaccine passport. But I'll remind those people who have been vaccinated, that's what that card is that we give you at the vaccination sites. Please keep that in a safe place. I often get asked, should we laminate it? I have heard stories of that certain lamination machines produce an intense amount of heat. And when that happens, it actually alters the stickers that we put on there. So I don't encourage that. I tell people, get like a sandwich bag that has a Ziploc on it and put it in that, put it away like you do with your passport, and then pull it out if need be.
Great, thank you. Angela, it makes sense when you describe how people have grown together during the last year. Is this something worth talking about with our employees? Can we promote camaraderie with war stories?
Yeah, that's actually a really great idea. So one of the things that can actually be really helpful is to give people an opportunity to say, hey, what's actually worked for you over the past year? What's been helpful in the work environment? What have you liked? What are these takeaways, the changes that have been made that you'd like to see retained? It can, one, give you some really good information about things that you might not be aware of, but it can also sort of promote that camaraderie, that sense of togetherness, that idea that, hey, we're all in this together. And in fact, it hasn't been all doom and gloom. There have been some real benefits from this.
Great, well, thank you. The next question, we'll start with Paul, but I'll encourage other speakers to weigh in if you have some insight. So Renee shares with us that they have a model with 3 different opportunities for returning to office that's listed in the chat room here. And the question is how to mentor and continue developing junior or new staff, but also be fair and offer the 3 models to everyone. Any innovative ideas to achieve this? Paul?
So that's a great question. I started to respond to Renee in writing, so thanks, Dr. Gilkey.
Okay.
We have time to address it. So, we're experiencing similar things, and I can't say that we have every situation figured out, but what we're doing that's worked for us up to this point is for people who are remote, but they're new to the organization, I categorize them in 2, one who's out of town and needs to be remote, and coming here would be, extensive travel. But that's the very few. The most are people in the community who can be on site for their orientation, have an on-site mentor who is appropriately distanced, and have that interaction at the beginning of their career with us, and then have monthly or weekly or whatever is appropriate to the person and the job intervals where they come on site, meet with their boss, meet with their colleagues or mentor. And that's worked really well to provide that balance. But I agree, it's much harder to start somebody remote, keep them remote, and engage them and develop some of those relationships. So if you develop the relationships initially, they take those with them when they go home to work.
Well, thank you, Paul. Well, we're coming on the top of the hour here, and once again, I find myself disappointed that the hour goes by so quickly. We've included some tools for you at the end of this presentation, which is listed up here. Thank you all for joining us, and thank you to our speakers. I hope this hour has been a help to support you, your employees, and our communities to safely manage your business. Just a reminder, we will be emailing you a survey right after our conference. Please be sure to give us your feedback so we can continue to provide relevant information. Our next session will be on April 22nd. Our theme is Embracing Diversity, Equity, and Inclusion. We'll take a look at where to start, community engagement and increased collaboration, embracing diversity, and the latest on COVID-19 and vaccinations. We will send you the link for this session. We encourage you to share the invitation with your friends, colleagues, and others who might benefit from this information. By working together, we will keep Maine safe. Thank you and have a good afternoon.